But one of the reasons why this is so important for healthcare organisations all over the world is because, as some would say, lean can actually save lives. By improving our processes so that we put the patient at the centre, that we ensure that our delivery of our services is performed with minimal waste, activities that don't add value to the customer, we can actually save lives. Healthcare service providing organisations all around the world need to improve. We need to deliver high quality care, of course, but we also need to reduce the cost of delivery at the same time as improving the service to our patients. So currently I'm evaluating a partnership between the Virginia Mason Institute, which is based in America, with our NHS here in the UK. Virginia Mason in particular have been implementing lean for sort of 19 years, I think it is now, to very good effect. So they are known as one of the safest hospitals in the world, and their approach has been one of the most effective translations, if you like, of lean from a manufacturing sector to a healthcare context. It's about focusing on value. So value from the perspective of the end customer. So in a healthcare context, this is very much about the patient. So we need to put them at the very basis of the improvement work that we do. So lean should start with understanding what value is from the perspective of the customer, and then ensuring that our activities and processes are all geared to delivering that value. And anything that isn't geared towards delivering that value needs to be eliminated. The pursuit of perfection is what lean is all about. And of course, that is an aspiration, but that is what should guide lean implementation. VMI are delivering fairly intensive coaching to our organisation, particularly executives within these organisations, about how to implement routines and practices that will deliver ultimately a capability for continuous improvement. Although we talk about lean in a very practical sense, in reality, what we need to see is a change in mindset. So we need to see organisations that actually think and do things differently to how we've done it before. Generally, we talk a lot about the importance of evidence-based knowledge and the use of evidence-based knowledge in our decision-making. And that's very important. But I think when we come to talking about driving service improvement and change within our healthcare organisations, it actually needs to focus much more upon peer-to-peer knowledge exchange and within the context of the hospital itself. And so I think what's really interesting about how we drive service improvement, or a systematic approach to service improvement within a healthcare context, is that we need to create spaces that are regularly used for informal peer-to-peer knowledge exchange, and that those conversations are informal, so that they're not threatening, they're safe, protected spaces, and that they happen on a regular basis, that we bring together diverse professionals in the one place to talk about delivery of care to patients. I think that is the game changer here. I think that's how we can drive service improvement effectively within our healthcare organisations.